Thank you for being here tonight for our Midtown Community Council meeting of January 14th, 2021. Sorry, we've been having some technical difficulties getting started tonight. We have added to our agenda two special guests that we will hear from first. With our COVID-19 numbers continuing to increase, we have asked for some current information, both from Ventura County Healthcare and Community Memorial Healthcare. Now, I haven't seen Gary Wild, Community Memorial Health Systems President and CEO, but we do have Chief Medical Officer Dr. Todd Flosi at Ventura County Healthcare. And we did send out some questions earlier and that we were hearing back from other of our members of questions they had. And the first question, there was 4 questions. How many COVID patients are currently in each hospital? How many COVID patients are in the ICU and number of beds? Has VCMC and CMH had to reopen beds in the old wing or other areas, and how many? And is VCMC and CMH experiencing any oxygen shortages? So Dr. Flosi, if you could enlighten us, and that would be great, or at least, tell us, reassure us that things are going to be okay, I guess.
Great. Hi, thank you guys for inviting me. As Dan said, I'm Todd Flosi. I'm a pediatrician by training, and I am the Chief Medical Officer at Ventura County Med Center and also the Santa Paula Hospital out in the Santa Clara Valley. It's been about a year since I took the job. I took the job on February 1st, 2020, just in time for our favorite event of the last 11 months, COVID-19. This has been my reality for the past 11 months, kind of planning for this, starting right as I kind of hit the ground, and ever since then. As you guys know, this, right now is obviously the worst that, Southern California, and particularly, Ventura County and the city of Ventura has had it throughout the entirety of the pandemic. We did have a little bit of what I guess now in comparison, what you would consider a mini surge back in July and August. At that point, the maximum number of patients that we had in the Ventura County Med Center, and I'll just speak to VCMC and not Santa Paula Hospital, but the maximum number of patients we had at VCMC back in the July-August mini surge was 20. Today, we had 41 at the county hospital. That's 41 adult patients. We actually have had, although some of those are, a couple of them are pregnant moms, so they don't take up the beds that otherwise, might be taken up for acute care during illness. So I guess we have 38 adult, patients taking up beds in the hospital. We have 6 of those are in our critical care unit, and that's out of 11 total patients in our critical care unit today. The question on beds is a tough one. So you asked. Our hospital is licensed for about 120 acute care beds, and 119 of those are in the new wing. We still have to remodel the 1980s wing to get more beds, and we have moved into the 1950s wing. So we opened 15 beds of that building, which we call the vintage building, but it's the main building that sort of runs along Loma Vista that you see as you drive down Loma Vista. So we have 15 patients in that building, with plans to continue to expand into that building as needed, because that building is still fully functional and was, a big part of our hospital up until October of 2018 when we moved into the new wing. So it still has the oxygen, the air, the plumbing, the HVAC system, everything is fully functional in that part of the building. So, if we were to see the numbers continue to rise significantly, we would be able to utilize that space, which comes in, really handy because it's already basically hospital beds that are ready to go, and you just have to plug in the equipment into the plumbed air and oxygen. So that was question number 1, was how many patients do we have? How many are in the ICU and the oxygen? I guess I should say the question of beds is always a tough one, and you'll see published, various places, what is the ICU bed availability? And really, you'll probably hear this from everybody who you talk to in the medical field right now in Southern California, that the real limiting factor ends up being staffing. we have been able to maintain what are known as ratios or nursing ratios. And any of you who've been in the medical field know all about that. But for any given level of illness, and there's critical care, there's step down, which is a step below critical care, there's telemetry, and there's sort of standard medical surgical units. There's different ratios that are sort of mandated by the state. So you can have one nurse for every 2 patients in critical care, 1 for 3 in step down, 1 for 4 in telemetry, and 1 for 5 in medical surge. We have not had to change those ratios. Other places throughout the country, I heard, at points during their, very large surges have had to change or go out of ratio. And that I think is a testament to, just how hard our staffing and our nurse leadership has worked to make sure that we have enough staffing. We've brought in nurses from around the country. Up until the last few weeks, it was a little bit hard to get those traveler nurses, which is what they're called, to come from other parts of the country because the entire country was experiencing a similar surge as Southern California. But as the numbers have gone down some in other parts of the country, we've seen the availability of critical care, ER, med surg nurses sort of open up for us. And we have quickly put in requests, orders, whatever, developed contracts with more than one of the companies that sort of, kind of supplies and doles out those nurses, so that we have extra critical care, ER, and medical surgical nurses all throughout both our hospitals. And then the last question you asked about was, has there been a shortage of oxygen? And at this point, there has not been a shortage of oxygen at either of our hospitals. If the Santa Paula Hospital, which again isn't, I know what you guys asked about, it's a little bit more space constrained of a hospital. It's it's meant to have 49 total beds, but really, it's a smaller space. So we are potentially going to have to move into a tent that's a 10-bed disaster tent that's out in the parking lot of that hospital. If you drive by the Ventura County Med Center, you've probably seen the disaster tent that sits in the parking lot on Loma Vista as well. Can you guys still hear me? My internet browser says I'm getting slow connection. You hear me okay still?
Yeah, we
cool.
can hear you fine. Thank you.
Yeah, so those disaster tents are actually really cool. They're set up where you can put 10 gurneys in them, and they're heated, they're lit, and they actually exhaust the air out so that it pulls air out of the tent, or what we call negative pressure, which has a lot of value when you're putting potentially contagious patients sort of in close proximity to each other. It helps protect the staff. It also helps protect the patients from each other, whatever illness the other might have. So and the reason I bring up the tents is that the tents are obviously not plumbed for oxygen, air, water. And so if you end up having to provide actual significant long-term care in one of those tents because we overrun space constraints, we would end up having to use the big oxygen tanks, not the little ones that go, that can be put on a wheelchair and go with you, but the large size ones. But you can go through one of those tanks pretty quickly if you're supplying a large volume of oxygen to 1, 2, or multiple patients. I have one other thing that I know, there's lots of things in the news, and I've been asked to sort of be on the news quite a bit. And so I can tell you some of the other things that the one other thing that is frequently asked by newspaper and TV reporters is ambulances. The news out of Los Angeles is that the ambulances are sitting in the ambulance bays for hours and hours and hours, and they're not offloading patients. That hasn't been our experience at either of our hospitals. And the report from the county EMS, who Emergency Medical Services, who kind of tracks this stuff, is that the average offload time from an ambulance has ticked up a little bit, but it's still less than 30 minutes throughout the county. Not anywhere near what you've seen reported on the LA TV stations or in the LA Times of ambulances taking 4 or 5 hours to offload a patient and having to provide care in the back of the ambulance. So that's good that all the area hospitals have been able to accept those patients, from the ambulances into their actual emergency departments, and puts the ambulances back in circulation to respond to emergencies out in people's homes. I'll stop there. I could talk all day, but.
Well, thank you very much. I'm looking to see if there's some chat questions. There's one from Sarah C. And just to, I guess to all of us, that it's very surprising considering per capita we surpassed LA County. And do you have any reflection on that?
You know, I don't totally know the answer. I mean, I didn't actually read that news story. I saw the headline, but I didn't read the news story related to our per capita cases. But you know, and in general, the cases do kind of, you know, fairly track well with hospitalizations. But you know, countywide, there are, I think I heard there were 430 patients hospitalized and 86 in critical care. For some reason, the county hospital, Ventura County Medical Center, is slightly less affected than some of the other hospitals. Right now, our population tends to be a little bit younger than some of the area hospitals, and we know that COVID, you know, tends to be a little bit meaner in the older population. So I don't know if that's part of why we're seeing a few less patients at Ventura County Med Center. I'm not totally sure.
Thank you very much, and really appreciate you coming on at such short notice. I've tried to send a re-email to Gary Wild as well, but I have not heard back yet. And I apologize to everyone. We just had a lot of these technical difficulties. I see we've got about 32 of us on right now, so it's very valuable information, and not a small group. I just wish we could get everybody on here, and I know Greg is still working on that.
Yeah, and yeah, just to let you know, I've sent out links to everybody, but also it's being recorded, and we'll put it up on our YouTube page, and then we'll put it out to Facebook, so everybody will get to see it. You just may not see it live.
Okay, well, good. That's great to know. Thank you. Are there any other questions for Dr. Flosi?
Did we just ask them like this, or is there a question?
Go ahead, Mike Johnson.
Well, hi, Dr. Flosi. I got a May right here.
Hi, Tom.
Hi, guys. Mike,
For those of you that don't know, this is Dr. Breckdosher. She works for the county, and she'd like to take this opportunity to talk about some confusion about the vaccination process. This is some important news that the county is trying to get out.
Yeah, I don't know if anybody watched the Q&A with Barry Zimmerman and Dr. Levin just before this, but one of the things that came up this week is the governor announced that we would be starting to vaccinate age 65 and up instead of 75 and up. But that is once we finish healthcare workers. And we just started finishing vaccinating non-hospital affiliated healthcare workers on Monday. And there are several thousand of these people that we need to get through before we can vaccinate that over 65 group. And what happened is a lot of the newspapers said, well, everybody over 65 is now eligible. And people got the links to register. And even though it says you can only register if you're in tier 1A, people registered, and that's going to delay the vaccination process because those people will be turned away, and then we won't be vaccinating the healthcare workers, and ultimately you'll be delaying your vaccine if you keep one of those appointments. So if anybody registered, and if anybody knows anybody who registered, do cancel those, and let's get through those healthcare workers as quickly as we can so we can get on to everybody else.
Yeah, and not just cancel if you have an appointment, but whoever sent you the link, talk to them and get them to talk to everybody they talk to, because, you know, if they're setting up 1,000 appointments, they don't want 100 or 200 or 300 of those appointments to get wasted. It's just going to slow down the whole process even more. So please just let the healthcare workers get their vaccinations first. Thank you.
Well, thank you very much. That's good information. And Dr. Flosi, that sounds right to you?
That sounds right to me. Yeah, I mean, I think
just checking.
There's obviously a lot of healthcare workers in the county, but there's also been a lot of them that have been vaccinated already through their either their work with the hospitals or their affiliations with the hospitals, and so I I don't know how many are left, and I think that if the slots were open and held for the healthcare workers, you could probably get through them pretty quickly, and then move rapidly on to the age tiers, which I think is absolutely the right thing to do. Get as much vaccine into people's arms as fast as possible. So I would say, yeah, you know, if you don't quite meet the tiering system as recommended, I mean, there's lots of different people on there, right? If you work in the jail, infirmary, you can get vaccinated. If you're a first responder, you can get vaccinated. But it's very clear on the Ventura County Recoverers.org website who should get vaccinated. But I'm all for vaccination if you have any questions about that.
Well, thank you again. I don't think we've been able to get a hold of Gary Wild. I don't see him anywhere on our list. And, you know, we've definitely had some technical issues. So is there been Commander Derek Brunk out there somewhere that I'm just not seeing? Someone said they thought they saw Ventura Police, somebody from Ventura PD on our site, but I do not see one. So I think we'll go ahead and move on. And just one other note from Sarah C. Thanks for all their emergency responders. And we can't be so, you know, we're so proud to have everybody working so hard to keep us safe and healthy these days. Thank you very much, Dr. Flosi and Dr. Johnson.
Thanks, everybody. I'm going to sign off. Have a great
Thank
night.
you, sir.
Take care.
Thank you. So we'll go ahead and move forward on our agenda. And so that would be Daniel Wall, and I see him here. So if you can go ahead and talk a little bit about what you've been working on and some of your plans. We had a discussion a little while back, and you had told me a few things that I thought were kind of old school, but a great idea to work on. So go ahead, Daniel Wall, Director of Ventura Emergency. I'm sorry, what is your exact title again? Let me see.
I'm the Emergency Services Manager for the City of Ventura.
Thank you, sir. Go ahead.
So can you all see me?
Yeah.
I'm working at a bit of a, yes, I'm working at a bit of a deficit because I saw all the faces on the screen, and now I see a thing that says Ventura Midtown Ventura Community Council General Meeting, because my bandwidth apparently is compromised right now. So I know that you guys are out there, but I don't see any of your faces anymore.
Okay, we can hear and see you fine. So good.
Perfect. All right. So hi, my name's Dan. I did see you guys when I first started. I was like 2 weeks on the job, I think, and I had come from the Public Health Department and the Emergency Preparedness Office, and like 4 months before COVID started. And so I moved over to the City of Ventura. Really excited about the opportunity. And then COVID hit a couple of months later. In those first 3 or 4 months, I had started working on our emergency operations plan to present it for council and do a few other things, including writing a bunch of policies and looking at our evacuation plan. And I know there's somebody in this particular meeting that was very acutely interested in seeing the evacuation plan. At the time, I said, I'll get back to you. And so then fast forward over the last 12 months, we've been working fervently on the COVID response. And what does that actually look like? We built an entire virtual platform, which is our Emergency Operations Center. We took it from a literal space over at Police and Fire Headquarters and put the entire thing on Microsoft Teams. So we have 109 people that have been continuously for the past 12 months or so, however long COVID is, seems like 4 years, but they are all on there, and we have copious notes from day one, which was March 12th or 15th when the declaration was signed. And so been doing a lot of work because that was built from scratch while we were working. And then I also have to say that it sort of delayed the emergency operations plan. And that document, when I first was introduced to it, they said this is not a public facing document. And I have to tell you that 2 days ago, I presented it to our PIO group and our administrative group to say that this will be a public facing document, and they were all very excited about the opportunity. So I will at some point in a future Midtown Ventura Community Council meeting be able to introduce you to and provide you copies of our city emergency operations plan. It'll be redacted, obviously, the police chief and fire chief, all different people's phone numbers will be taken out, but the basic construct of the plan I think will be very important for you as citizens of the city of Ventura to see. And then during that time, in the past probably 4 to 6 months, I started asking a lot of questions about the evacuation plan. And come to find out, and I wish I could see your facial expressions. I don't know how many of you, by show of hands, because I can't see your faces, have seen those evacuation plans. But the best way to describe it is they are maps of given parts of the city with arrows at corners where traffic decided that you should go to evacuate from a fire. They don't have any explanation for the arrows. They don't have any explanation for the flows. They are what we have been purporting is the built plan for evacuation. That doesn't meet my standards, and nor should it meet your standards. And so I will provide Dan Long and Greg with a copy of those plans. But I'm here to tell you that within my certain guarantee is within the next quarter, we will have actually an effort that is inclusive of each community council group, a collaborative effort with city administration, myself, and the community councils to develop collaboratively evacuation plans. Because having maps with arrows on them, and they're literally just pages and pages of maps with red arrows on them, does not constitute an evacuation plan. So we currently have one. It's not popular to say we don't have one. We have one, but it is not a plan from my perspective by any definition. So we're going to be working on that, and we're going to continue to pursue all the efforts with regard to COVID. And so, Deanna, I want to keep this short and sweet because I know you guys started late, and I'm imagining there's probably some questions. But I certainly will be coming back to this group with actual work that I've done to present it, hopefully in person within the next 6 to 12 months. But I take questions if you'd like.
Yeah, I don't see any yet, but I did want you to maybe mention when we talked on the phone about ham radio operators, and are you still looking? Because I thought that was old school, but something that is really important.
I was, and I told you guys before, I born and raised in and out of Ventura. I left for the military and came back. I look at this town as now my new responsibility. My grandfather was a W6 GGU out of San Jose, California. Ham radios in an acute disaster like an earthquake, which is very likely the next scenario, unfortunately, it's something we should plan for. My conversation with Dan was related to how many ham radio operators do we have in each community council, and where would we find one for each council? Because what I'm prepared to do with the grant funds that we currently have is buy a base radio, ham radio station for each community council. And I think that it will both serve us well on a lot of different levels with regard to communication immediately after catastrophic disaster. A ham radio is completely self-contained. The base station would have a backup battery, and then we would have a group that could join the countywide group to basically geographically geo-cover the city of Ventura. So when the lights go off and the earthquake occurs, we just have to have somebody from each community council go and turn the radio on, and then we still have competent communications amongst all of the community councils within the city of Ventura. And so if my long-term vision is to have a Connex box or a shipping container, as it's commonly referred to, and have that ham radio station and a generator and a few other items cached for each community council to just open the doors and start servicing their respective area of the community. So we're going to start with ham radios because I have the funding currently, and then we'll move on to Connex boxes and caches of disaster supplies. That's my plan.
I just think that's such a great idea. When you told me that, I didn't want to, surprise anyone. I wanted you to talk about it because you do a much better job. So I guess there's one question from Greg Mansford. What are the basics every house should have right now for an emergency?
So I'm glad you asked that question. So another piece of work that I am working on, I've already written the manual. It's in a draft format because our legal group, Greg Diaz's group, needs to look at it from the perspective of liability and stuff like that. We are going to stand up a City of Ventura CERT team. There's a high level of interest for volunteerism, and I want to kind of lead that charge. I'm going to apply some grant funds toward that effort as well. And within that effort is community-based education related to preparedness. So there's currently a CBD, don't try to repeat this one, CDBG, community-based block grant for mitigation of disasters. That's there, and it's specifically earmarked related to post-Thomas fire recovery. The application is due on February 19th, and so I'm going to start drafting a version of that cuts out an allocation for building the CERT team, but also community-based emergency preparedness. So how that's going to start, we're working with CAPS, which we have a contract with, to develop videos related surrounding emergency preparedness. But I think that I'm going to hang my hat on building and being responsible for the City of Ventura's CERT team, what that can look like. And I'm going to throw this out there. And again, I would like to see your facial expressions or some confirmation. The reality is, I think that each community council may end up owning either their respective members that want CERT training, or in modules, a portion of our CERT team. And so it may be that many of you have an interest in kind of learning about community emergency response and what that encumbers. And so that will be that's going to be the path for me to kind of propagate emergency preparedness concepts throughout the community. So that's a big one. But I have the grants, and I just get me started. Let COVID be over first, though.
And we understand that everything moves a little slower with COVID, but it sounds like all of your plans are really going to be helpful for all of us. So I just want to thank you for working so hard to protect us all and keep us safe, as well as everyone else who we talked to this evening. So I think we're going to go ahead and move on, since we are running a little late, and I still see we have new people joined us. Again, we apologize for technical difficulties, but we're moving forward, and we are recording this. So if you missed something, you'll be able to go on in a few days and see what you missed with the information.
Hey, Dan, one last thing before you move along. I wanted to address something that comes in the form of the COVID hotline, and it's really a kind of a thing where related to COVID hotline and related to business non-compliance. And we as a city are completely following the health orders from the health officer and from the state health officer and all of that. But every person within your group can be an ambassador to that end. There are a number of businesses within our community that have taken it upon themselves to make incorrect choices. And so I hope that this group can be a kind of a mouthpiece for the city and for all of us collectively to say, stop doing that, start wearing your mask, and keep driving forward. We are legally pursuing a number of businesses that keep coming up. The county DA is pursuing them, but the city's very, very concerned about this spike in COVID right now. So we're all doing our part. I just wanted to kind of leave that gesture to say, continue to remind people what the right thing is to do.
Well, thank you. And yeah, I have, preached about the mask a little bit in some of our newsletters, and it's just really sorry to see that more people aren't being a little more careful. So
for sure.
Thank you.
You bet. Thank you, Dan.
Hello. I apologize. I don't know who's speaking, and I'm trying to raise my hand and get in here, but could I possibly address Dan real quick?
Sure.
Okay, my name's Pete Freeman. I'm from the West Side. I'm joining you guys for the first time, and this platform is totally new to me, so please bear with me. But Dan, just real quick, from what you said you're coming up with evacuation plans, and it's been 2 years plus since the Thomas fire. And on the West Side, we had a total, I want to say a bad word, but we had a total mess up over here, trying to evacuate that night. Is it going to be, how long is it going to be before you have an evacuation plan? And
well, we currently have evacuation plans.
Sorry, let me cut you off real quick. Sorry. Currently, with the weather today, it's January, we're having Santa Ana's and hot weather. It seems like an evacuation plan is a priority to get people evacuated in a safe and sane manner. So if you can please address that.
Oh, for sure. So just after the Thomas fire, they did develop recognizing some of the issues that we had with regard to evacuation, and there were quite a few. They did hire a consultant group, or they made a collaborative group with traffic safety and others to develop the current evacuation plan. So the city of Ventura currently has a document that they refer to as their evacuation plan. This evening when I spoke, it was related to the revision of that existing evacuation plan to consider other threats beyond fire. And so I'm certain to say that we currently do have an evacuation plan. It is going to be bolstered within the first part of this year to include other threats and then be a more comprehensive plan. So just to answer your direct question, we do have a plan that was written after the Thomas fire, about 6 months after the Thomas fire. That's the current plan that we're working with, and we hope to revise it within the next 6 months.
All right, thank you. And for those of you that aren't familiar with this GoToMeeting platform, the chat section at the top is how you can ask a question, and then we'll read it. So I think we're going to go ahead and move on because we're already running quite long on this meeting from what we had planned. So I would like to a couple of things first. I wanted to I think I saw Christy Weir on our meeting tonight, and we really appreciate all the work that she's done for Midtown all these many years and continue to do. And I know Doug Halter is also with us tonight, and our newest, we actually have a conditioned city council person for our district now. Christy was the acting one, and now we have, and they're both good friends, and they're both will collaborate, and that's really good news as well. So congratulations, Doug, and Christy, thank you for all your service all these years. So I forgot that earlier with all the technical difficulties, but we really appreciate both of you working so hard for so long in this community. So let's move on. I see Christy clapping her hands. So let me read my thing. So Peter Gilli, City of Ventura Community Development Director, will address some of the new development review process changes. And when we first thought when we booked it, I thought we were gonna talk about the general plan, but he corrected me. And instead we are talking about some of the new design review process changes. And I will let you take it away, Peter.
Thank you very much. Hate to change what I'm going to talk about again, but I was going to be talking about what came up at council on Monday, and because there were a lot of other big items on council that night, the item got pushed. So instead of having news about that, I'm shifting a bit. There is still good information out there if you are interested in the topic, but if you are really interested in the topic, I think the best thing to do would be to when we do reschedule the update on the streamlining ordinance, watch that, whether it's live or the recording. We do have a staff report out there. If you go look for the agenda of January 11th, you'll see the link to the staff report. But I think the slides that I was going to be going through, as well as the presentation, are a little more easy to follow than just reading through the staff report. So I'm going to not touch anything more on streamlining. Happy to answer any questions, but go and touch on a few other topics that are interest to the community and I think to the area. There will be a handful of other what I think major items going to council just in the next few meetings as well, beyond the streamlining. We're also going to have the GPAC appointments scheduled to go on the 25th. The GPAC is going to be an advisory committee for the general plan update. They're going to be, to try to explain what they're going to do as easily to understand as succinctly as possible. The consultant group, Ramey & Associates, who I believe have talked to your community council and others, they are experts on general plan updates, but they'll be the first to admit they are not experts on Ventura. The GPAC are going to be the support for Ramey & Associates. The GPAC will be the experts. So the sounding board for what issues and outreach plans that Ramey & Associates will be working with. So council will be appointing that group on if everything stays on schedule, on the 25th of January. The application period for GPAC was in the latter half of last year. Also coming up very soon, the commercial cannabis regulations. This was last heard by council in November, and at this point is tentatively scheduled to come back to council February 8th. So those are a few things that are coming forward that are of citywide interest. I want to quickly talk about housing projects because I know that is of interest to many people in Midtown. There's in the past, a few years ago, and prior to that, it would be very common that a housing project would come forward to either the Planning Commission or to City Council. Members of the public would come out, note their concerns with it, and the Planning Commission or Council would knock off a story or two, would take out a wing of units or so on, in response to what the concerned residents had to say. Well, the state changed, or the state passed laws directly in response to some of these things, because admittedly, this is something that was not just in Ventura, it was statewide. So now we're at a point where basically state laws say that if the city rules allow the number of units being asked for, our ability to deny the project is very limited. Now, there is a very big caveat to this. If the proposal is not allowed by the city's general plan or zoning, and the project has to amend the general plan or zoning, then the city retains full 100% authority. And I bring this up because, as many of you interested in Haley Point are aware, Moorpark denied a project by the same developer that looks similar to what's being proposed at Haley Point. And for those that don't know, Haley Point is on Channel Drive near Seaward. It's a ownership housing project, but it's attached units. In Moorpark, that project on that site needed a general plan amendment. Haley Point at site on Channel does not. And so we do not have the ability to simply say no. Want to point that out because we did get an email from concerned residents saying, why won't we do what Moorpark did? The reason we can't, because it's actually a different situation when you look at the city's plans compared to Moorpark's. We expect formal hearings for Haley Point are going to occur in the first half of 2021. The first formal hearings will be DRC. The project as it's currently designed, staff does not fully support. There are some things that we have concerns about, particularly where the driveway is located. Our transportation staff believes that the driveway should line up with one of the street intersections as opposed to being mid-block. Neighborhood input on that could end up helping. Do you agree with the traffic staff or not? But at this point, there are some changes that we would recommend that DRC and Planning Commission make that the applicant's not willing to do at this point. But the applicant has that right. They don't have to listen to staff. They don't have to listen to anybody. They take what they want to the hearing and see what happens. Staff, we have the ability to recommend that certain conditions be placed on the project, also whether the applicant wants to or not. And as long as that meets a legal nexus and such, we can do that. So we can't say no to the units, but there are things that we can talk about, and we are looking into those as best we can. For those who are interested, please keep in contact with the project planner. You can, if you don't know who that is, that's Jamie Peltier. I think most of you are involved in following the project probably have her email. For those who don't, we have a tool called the development map that is online. It's a tool that was launched in June that we really want everybody in the public to know about. We have put every planning application on that map, and we arrange it in a manner that it's a Google map, and so there are flags where the projects are, and the color of the flag determines where the project is in the process. If it's a certain color flag, it's new. It just came in. Another color just means it is in the process. It's being reviewed. There's a color for being scheduled for hearing, which is very important because if you live near a project, you might get a hearing notice. But there could be projects that you don't live nearby that still matter to you and you're interested in. You could go to this map and at that point in time see every single item citywide that is scheduled for any of the hearings. HPC, DRC, Administrative Hearing, Planning Commission, or Council. So instead of having to follow agendas and see if there's an item, the map just has it all. Also, it has items that have recently been acted on. What that means is that item is in its appeal period. So that's also a way of letting people know this item just got acted on. You know, if you are concerned with it, want to know what the action was, and possibly appeal, these are the ones to look at. We put that map out there to give information, to make sure people knows what's going on. Unfortunately, in a lot of these talks, I have to come to you and say, state law says we can't do this, we can't do that. But we can tell you what's going on so you can be involved. We want you to be involved early because 9 times out of 10, you are going to have more influence on a project if you get involved earlier rather than later. And that is just because of the nature of the process. The developer has to go through multiple rounds with city staff where we ask for changes. There's issues of something might not comply with a regulation or we have a suggestion. They update their plans, they give it back, and we look at it. Eventually it goes to hearings. Once a developer goes through a few rounds of adjusting their plans to respond to staff, each revision is money, and so they start to get a little tired of making more. So if you only get involved at the hearing, you're coming in at kind of the spot the developer is least interested in making changes. But if you get involved earlier, contact staff, let us know your issues, and if there are issues we can actually do something about, issues that a state law doesn't preempt us, then the developer is more interested in looking at that. I'll be honest, some developers will say, I don't care, I just want to do this, and that's their choice, and we'll tell the boards that residents suggested this and this, and staff suggested this and this, and the developer said no. That decision makers tend to not like when they hear that a developer does that. And so that's also where courtesy notices comes into play, which the community councils are now getting. And just for clarity, we do not just email the community council the courtesy notices for the projects in your area. We send you the courtesy notices for everything. Admittedly, that is partly because we want to skip the step of trying to figure out what's in each community council area. So it's easier for us, but it also means the community council, you get to see everything that's going on because there are projects outside of maybe your boundaries that your residents care about. And so those courtesy notices happen earlier in the process before the hearings, and thus folks who get involved are able to. The one caveat I want to give about courtesy notices, it is early in the process. So if you provide questions and comments, you might not get a response from the applicant. I mean, you give it to us, we pass it on to the applicant. A response might not come immediately because the process does take several months where an applicant might go back and look at things, update their plans, and turn it back in. So you might tell staff, I think you should do this, this, and this, and we might try to get some of those through, but we don't actually know if they follow any of them until much later. And you could get frustrated. And so I just want to provide that as context for if you're getting a notice early, that is part of the reason why you may not get a fast response to or results on what's happening. So, I mean, with that, I don't want to go on too much further. I want to open up for questions because there could be questions about projects, streamlining, or anything else that's out there.
And Peter, just wanted to know, do you have the address for the citywide map of projects? Do you have that available with you tonight? I know you're at home.
Yeah.
That you could put it on our chat line. on our chat function.
I don't have the address, but I can point you right to it. If you go to the main web page, or if
Peter,
I can be allowed
Peter,
to share the screen, I can show it.
Yeah, Peter, I can. I'll take care of it right now. I'll go in and grab it. It's on the front of your development page. Is that correct?
Yeah.
Yeah. Okay. Great. I'll grab it and put it into for everybody right now.
Okay.
Thank you, Greg.
Thank you.
And so I do have a couple of questions, and but Peter, before we lose Dan, there was one question that came up right at the end, and a couple of people have asked about that as well. So just real quickly, Sheree Egbert asked if the freeway on and off ramp design slows down an evacuation, such as Stanley stop sign and on ramp on the west side, could there be funding or grants to assist in changing the road design to assist evacuation? In an evacuation.
Was that posed to Peter or myself?
That was to you, Dan. Sorry. I was going back
So
before we lost you.
No worries at all. But I'm glad that Peter's here on the screen so I can look closely at his facial expression as I tell you what I think can.
I think you need to lose the visual because you're
traffic
breaking
planning
up.
and freeway on and off ramps. Uh-oh.
Yeah, Dan, you're going to need to lose the visual so we can hear you.
Okay, let me shut down. Okay, hold on. Is that better?
We can hear you. That's
Is
the
that
main
better
thing.
now?
Yeah. So
Perfect.
did you get the question?
That's a many-angled question. Yes, the question was related to the Stanley Avenue on-ramp or off-ramp related to evacuation, correct?
Yes, and if there's grants available, are you able to change how it's configured?
I almost think that it's better that Peter answer that question. I think that the reality is anything is possible depending on what grant funds are available. But when you start talking about disasters and the flow of traffic, we're talking about a big project. And so I can imagine that there's probably a lot of conversation about Stanley Avenue on-ramps and off-ramps because of the way they're configured is a little bit archaic. Peter, how would you best answer that question? I don't want to speak out of school, but I think anything's possible, but I think that so before you answer it, two thoughts. There is the concept of contraflow where you get everybody flowing in the same direction on all lanes of the freeway as applicable to get away from the harm or the threat. But the reality is that is done with current roadways, the current ramps, the way they are configured. I saw that question and I'm not 100% sure I feel comfortable saying this is possible. With a certain amount of money, anything's possible. But Peter, is there plans for the Stanley Avenue ramp, or how would you answer that if it needed to be widened or made more appropriate for evacuation purposes from the west side?
Dan, I'm not aware if there are any plans for those improvements. Those could be the type of things we do talk about in the general plan, but clearly that means it's not going to be, immediate. One of the most difficult aspects of evacuations, no matter where you are, is that the roadway network was not designed for everybody to be on it at the same time. There is nowhere probably in the world where the roadway network is designed for everybody to be going in the same direction at the same time and have it work. I worked in the city of Teal prior to this, was there during the Woolsey fire. Didn't hit Teal much at all. Clearly it hit Malibu hard. People were stuck everywhere throughout the whole city of Thousand Oaks because no matter what, there's limited number of access points to a freeway and roadways and such. These are more modern on-ramps and off-ramps and such. So this is a very difficult question to answer. I was at a council meeting. I think it was in late November or early December. It was a council meeting to talk about Thomas Fire and lessons learned and such. And I don't know if it was Chief Schindler or Chief Ndaya who kind of commented on the fact that there's no way to design the system so that it's going to be able to get everybody in a car out as easy as possible. Public safety's focus is to get people out. And while everyone doesn't want to leave without their car because of the mobility that you would need if you are evacuated, when push comes to shove, police and fire are going to be focused on getting the people out.
Okay, thank you. I've got a couple other questions here that I would like to try to get to Peter. And
real quick though, that is part of that evacuation plan, is getting input from each community council group, and so hopefully we can more appropriately come up with an answer in development of our evacuation plan.
thank you.
Of course.
And Greg Mansfield did pull up the on the chat line. He's got the address to get to the map of all the projects in the city and where they're at with the flags. So Patty, and let me see, hold on here. The first question was, is it not clear? It's not clear to me why streamlining was needed in response to COVID-19 pandemic. Can you explain? That's from Miles Glasner.
Yes, happy to. So when we have a process, regardless of the department, that is viewed as inefficient and more staff time is being spent on it than maybe needs to be spent, that means other things aren't getting done. And so, and I was very clear about this at the May 18th meeting, the streamlining of the hearings would affect all projects. The time saved by that streamlining helps free up staff time to do things. Many things that planners are asked about don't require hearings. They're administrative things. The things that most small businesses and residents rely on don't trigger hearings. If whatever time is saved doing X frees up time to do Y. Case in point, when the health order came down that started to allow businesses to operate outside, it said you couldn't be inside, but you could start doing things outside. There was a flood of a need to look at all the sites where these property owners, not property owners, the retail businesses wanted to start to go out. That needed to be looked at by somebody. Economic development was our lead on that. We have specific economic development staff, but planning had to support it. So time saved on these hearings frees up time so that more time is available to approach something like that. That's one example. So it's not always a direct connection. If you look at the results of what projects have had their process changed, roughly half of them are minor that I would say the average resident would say, okay, I can see the direct connection. And yes, half of them are major, where it's like, wait, how does this housing project streamlining matter? The point is, if the staff person can save a few hours on that project, that few hours gets to be spent on other things. Now, a lot of the concern with some of the public is, well, you're cutting out the public, you're cutting out these hearings and stuff. For all of those major projects, if you read the report for the 11th and watch the presentation for whenever that hearing ends up being, the bigger projects did not skip any hearings. The bigger housing projects, they still went to DRC, and then they went to whichever the next hearing that the ordinance said it needed to be. We tweaked some of it so that there'd be less time having to be spent on paperwork, but there were still the hearings, which meant there were still the same notifications. That was actually expanded because of courtesy notices in the map. And there was still the same opportunities for the public to speak. So in a nutshell, that's what the connection between the streamlining and the COVID response was.
Okay, and you know we're running long because we started late, and but I do have a few more questions for you, Peter. What is the protocol for community councils to send the notifications to their email list? Once a month? How quickly are the notices sent? And I can also just say that we get them haphazardly. I mean, when there's, you know, we get sometimes as many notifications that a meeting is canceled because things are, you know, the way things are right now. But they come in as meetings get set, usually 1 or 2 or 3 a week, or sometimes none. Can you add to that, Peter?
Yes, so there's two types of notices that are happening now. The courtesy notices that come early, which came from the emergency streamlining ordinance. That is sent when a project early in the process, there's no set time. So yeah, the community council, you might get one on Monday, one on Wednesday, one on the next Wednesday. The ones that are for hearings, they will come more in clumps because we send the notices out for a DRC meeting on a certain date, and so the community council is going to get those on that date. So it does rely on the community council team to spread them out. One of the things we're going to be looking at doing shortly is setting up email sign up so that if folks want to be notified as quickly as possible, you can just sign up, and when they're sent out to the community councils, you'll get it too. We just haven't set that up yet, but it's something we're working on. That could also take some of the pressure off the community councils. For example, if a certain community council directs all their members, if you are interested, please sign up on the city's mailing list, then that council might not have to take care of that virtual paperwork, if you will.
And Peter, and that's something we just had someone that wanted that, and I gave her Luz's contact to ask to be put on that list, because it's impossible for us to keep throwing out all these different emails all the time and have people be able to catch them. So I'm glad to hear that's happening, because yeah, it's very hard for us to do that. We've talked about.
I appreciate that. Yeah. Well, and the idea for emailing the community councils, immediately we didn't think of that. We thought of the courtesy notices, but it was at the council meeting that council members said, hey, in addition to doing these courtesy notices, why don't you send them email to the community councils? So it's been kind of trial by error and stuff. We're going to do the mailing list approach as well to try to not make it as much of a burden.
All right, and I'm just going to ask a kind of a combination of a couple more questions, and then we're going to move on. And I'm sorry we don't have more time to go further into a lot of things that people are interested in, but we're just running out of time. It just was a tough night.
That's yours.
So I know that the Haley project, let's see, there's a couple of them here. I'm going to try to combine these two. From Patty and Glenn Overlay. Peter, what are some of the changes you have requested from the developer for Haley Point? And Christy, to everyone, the Haley project refers to Seaward as an access point, but getting from Channel to Seaward is awkward, and you get from Seaward to Channel. That means traffic needs to go through the neighborhood. There is no adjacent bus line. Please discuss traffic impacts.
So let me start with the first one, because I'm also scrolling through the chat, so yeah. I can see them. So at this, I don't know all the changes that staff's asked for. If you want like the complete list, you would have to reach out to the project planner. I know the ones that are more of the sticking points at this point that the applicant so far has not been willing to make the changes for. If you look at the plans, there's a mix of 2-story units and 3-story units. For the most part, what's along Channel are 2 stories, but I believe there is a section that is 3, and we've asked them, you know, can you rearrange things so that the 3-story units are more on the railroad side, and on Channel they're kind of all 2-story. I don't believe they have responded to that yet. Mentioned the main entrance, the main driveway entrance off of Channel. Our traffic staff, transportation staff would like that moved over. Tied to that, we want them to move that. They have an open space that is directly aligned with their driveway, so that if you're on the street looking in at the driveway, you don't see garage doors or something. You see their open space, so you have a more pleasant view. We want them to keep that open space aligned with wherever they move their driveway. Admittedly, that will not be as convenient for future residents because right now the driveway and open space are kind of in the middle of their project, and by lining up with the intersection and moving the open space, that's kind of prioritizing the view from outside in. People in the project will have to walk a little longer to get to their open space, but we still think it's important. We're asking, well, our rules require them to underground utilities along their frontage, and they're kind of trying to find a way to not do that. We're pretty much pushing back on that. And then the only other detail that my staff's told me about is there's a segment close to Seaward where there's a handful of units, I think 5, that basically face the railroad wall. And the idea of the front doors of units facing what's likely going to be a 9-foot sound wall, not the most pleasant residential interface. Now, admittedly, that's the people who are going to live with that are the people who are going to buy that unit. So in some ways, that is a choice. I don't know if we'll end up pushing that too hard, but we asked them, is there some other thing you can do in order to make that more attractive living environment? We can't ask them to reduce the number of units outright. And most of what we have heard from the neighborhood seems to go back to the unit count, because another comment was about traffic and stuff. Traffic's tied to units because the estimation of cars is tied to units and such. So let me see.
So
then there's the question about traffic impacts. Off the top of my head, I don't know the answer to this. I do know our transportation staff has looked at the project. To the best of my knowledge, they have the information they need to write their conditions of approval. So I don't know if they're going to ask for more traffic reports, but that's something that we can follow up on with the planner.
And the last question, or I guess just the last comment, actually, it says the project planner does not respond when we reach out. So I think that's can be a problem the way things are, but are we trying to do a better job? I know I heard the city manager talk about making sure that everybody responds better than, even though they're not at home, their call should be forwarded to their cell phones at home.
Well, not every employee gets a cell phone, so but every employee, at least the planners all have laptops, and in the laptop we have soft phones. So basically, the planners can access their phone through their computer. So
okay,
not exactly cell phones, but the same difference. They have the ability to talk to you. If you are not getting response, please copy me on the emails, and we'll take care of that. The planners do have more projects than they're able to honestly handle. So I don't know that you're going to get quick turnarounds, but there's still the reasonable expectations.
And there's some other comments, but or they want your comment on, but we do need to move on because we're already out at the end of our meeting, and we still have Thomas Cussins, who's been patiently waiting all evening. And I'm going to go ahead and turn it over to him. And Thomas Cussins of Ineffable Music. We just kind of want to talk about his plans to reopening the Discover Ventura building at 1888 East Thompson Boulevard. And he did want to get some input from us to see if this is something that he wants to do. So Peter, thank you very much. And I'll turn it over to you, Thomas.
Thank you, Dan, and hi, everyone, and thanks to the Midtown Community Council for allowing me the time to speak tonight. I'm going to do my absolute best to keep it super short and sweet for everybody. I do have 6 topics to touch on briefly in relation to the building that's currently known as Discover Ventura. The topics are my background, our goals with the property, the economic impact, the community impact, noise issues, and parking issues. So I'll just start with my background here. My name's Thomas Cussins. I co-founded my company, Ineffable Music, in 2006 with my college roommate at UC Santa Cruz. We presented our first concert while in school. We made $300, used it to start the company. We've been pursuing our version of the American dream ever since. As we've kind of organically built our business over the past 15 years, we now own or operate venues in San Luis Obispo, Santa Cruz, Felton, Berkeley, and Petaluma. So even though now we produce over 1,000 concerts each year, at least before the pandemic, I still get that same, joyous feeling when we're experiencing live music together with friends and neighbors. And that's really what it's all about for us. So our specific specialty is having high-level bands in small venues. On any given week in one of our venues, you might see a legendary songwriter like a Robert Earl Keen, followed by a rising country artist like a Eli Young Band, reggae pioneers, Steel Pulse, maybe then a bluegrass band, Trampled by Turtles, wrapping it up with an actor who got the music bug like a Billy Bob Thornton, who we've worked with a bunch. So our goal now, that's very short abridged. Our goal is to turn Discovery Ventura into Ventura Music Hall. Dinner and a show, entertainment for all genres, all ages, and to make Ventura Music Hall into a living room of Midtown. And that's really how we think about our venues as they generally are in residential areas or abut residential areas. So the idea is a place that everyone can gather when it's safe again, of course, enjoy a great performance. We book 95% of our own events ourselves. Very rarely do we work with any of outside event producers. This ensures that the people that come to the venue are there for the show. It's not a party. It's not a nightclub environment. People are here for the music. That's very important to us. To touch on the economic benefits, our project would bring 50 jobs, part or full-time, to Ventura. The lion's share of those would be new local hires. The great thing about this project specifically is that the benefits, economically speaking, go far beyond the jobs that we bring. NEVA, which is the trade group for the concert industry, conducted a study that showed that for every $1 spent on a concert ticket, $12 is spent by that concert goer in local hotels, restaurants, retail stores, and other businesses on the day of the show. So I feel very strong that this project would let us see a huge economic multiplier effect in Midtown specifically. Now to touch on the community aspect, we're committed to adding a $1 per ticket fee on every ticket at the venue at Ventura Music Hall to donate to local community projects. We anticipate this would be around $50,000 a year once we're at full operational capacity. So that would be going to local causes that are most in need, school music programs, local food banks, the Boys and Girls Club. The list goes on, and I would look for your input on where that money is necessary and where it can have the most impact for the dollars. So additionally, on the community aspect, we in all of our venues, we work with local nonprofits to stage events at reduced or free fees. So we're currently talking to the Ventura Music Festival about a partnership like this, and previously we've hosted fundraisers for all sorts of important community issues at the venues. Usually 5 to 10% of our events are community themed in nature, so either fundraisers or free events for the community. So now to the kind of the trouble spots. Noise, we understand, we're very clear on the fact that Discovery Building is in a neighborhood. To that end, we have put together a plan to reduce any noise coming out of the building. That would be building a second doorway at the front entrance so that if someone walks into the building, the noise does not pull out right onto Thompson. That I think is initially just right away a huge reduction there. We also want to put heavy sound curtains on the glass windows that are facing Thompson. That would be closed during any concert performance. Additionally, those sound curtains we would put on the rear doors at the backstage, so that if anyone's leaving and there's noise going on, there's less noise coming out. The additional sound thing that we would do is work with a kind of a sound engineer to install some tech-type paneling. Now, this paneling, right now the noise in that venue would bounce all over the place off sharp walls and start shooting out any direction it possibly could, just how it's laid out. The way we would have it, the tech-type paneling would keep the sound inside, not letting it bounce, but kind of contain it within the space. So with all those measures, we feel really confident that there would be minimal impact to the surrounding neighbors. However, the other issue that I'd like to speak about, which is the parking issue, when I walked around South Santa Cruz Street, South Santa Rosa Street, and talked to neighbors, as part of our due diligence on the property, the thing that came up the most from the neighbors was that people often parked in the neighborhood. So there was littering throughout the neighborhood when there was a big event, loitering and other kind of unseemly activities. So we would go about combating this in 3 ways. One, great communication with the patrons to encourage ride sharing. If you're coming out to an event and you plan on having a drink, you're right. Take a Lyft, take an Uber. That when we communicate that with tickets, we find that we get a great reduction in the number of cars that come through. We're in the process of discussing with neighbors that have parking lots about renting or working with them on using their parking lot. Dwayne Harris, the owner of Fuller Paint, has already indicated his support for using his parking lot for additional overflow parking. The other aspect of the kind of parking and sort of loitering and trash issue would be that one or multiple of our employees in the opening and closing procedure at the venue would be walking the neighborhood, picking up trash, ensuring that no folks are sitting in their cars loitering or doing anything that they should not be doing there in town. Obviously, the last thing we want to do is have folks sitting there disturbing their residents. So I am currently in contract to buy the building, but I only want to move forward with the project with the support of the community and city. I have frankly been overwhelmed with gratitude at all the people I've met during the due diligence process. It's made me incredibly excited to move forward on purchasing the building and making Ventura Music Hall something that everybody can be proud of for many years to come here. It's been wonderful just getting to meet everybody and how much everybody is involved and been willing to give me some feedback and lend a helping hand in this process. So I really appreciate everybody's time. I'd love to hear thoughts, questions, comments, concerns. I'll share my email here in the chat box. If anybody wants to reach out directly for follow-up one-on-one, very happy to do that. I hope everybody stays safe and thank you very much.
All right, and I know we have one question. Do you plan to keep the bowling lanes?
So in my research of the area, I found that there were 5 other places people could go bowling and only 1 other place people could attend a high-level concert in a small setting. So no is the answer. Additionally, when I was doing more research, I found out that the types of bowling lanes that are currently installed are not the kind of professional quality. They're on strings, and I'm not a professional bowler. I'm a music guy, but I found out that that's not ideal. And so the idea would be to open up the room. There's a lot of trussing and things in the room right now. So our idea would be to open it up so it flows, because it's a beautiful wood ceiling. It's a fantastic space with a lot of stuff really well done. But no on the bowling.
Yeah, and there was a question about how do you plan to open during the COVID, and I don't think that is your plan to open until this would be quite a while before you would be opening up after redoing things, correct?
Correct. At our current venues, we are anticipating October at the absolute earliest to reopen. So our thought process as it relates to this project, assuming that there is good support and everybody wants us to move forward with this project, we would be aiming for a January 2022, I guess. I can't believe it's 21 already. That would be our goal. We have the time to do it right, and that's what we intend to do.
And I would add this comment. I talked to Officer Bernadette Campion from Ventura PD, who does all the alcohol permits. And I know she's talked with you quite a bit and some other folks. And I spoke with her, and she was reassured that you were looking to be a good neighbor and trying to do the things. And one other thing, because that alcohol permit that was there went with the building when they had bought it before, they couldn't enact all the different compliance issues into the contract into the policy from the city. That will come to you. So there's a lot of about loitering and graffiti and all kinds of other procedures that have to be followed. So, just so people know that there's a lot of rules that you'll be having to follow that the previous owners did not have to follow. There's a couple other questions here. Can you see any of them on the chat line, Thomas?
Yeah, I can go off these questions right here.
Just quickly, please, because we do need to get out of here.
Absolutely. No, I do not live in the area, although I have notifications set up for houses between Thompson and the beach, because in my time down there, I've loved it. So I live in Berkeley, California right now. I see a question about opening the room up and using more acoustics. Completely agree. People at a concert, it would obviously depend on the fire marshal and everything in terms of that, but I think it's probably appropriate for 600 to 700 folks at the most, or for a seated event of 300 to 400. Current bowling is pointless. I think you need to expand your research area. Okay, so have you used this sort of soundproof in your other venues? Yeah, absolutely. For example, in Felton, California, we have a neighbor immediately behind our property, and she has been like ecstatic with how we've handled the noise and the flow and the overall impact on the community. Just to give one small example, but yes, in Berkeley, the neighborhood before we moved in, there was a lot of homeless folks, a lot of drug use on the street. And us moving in, it really cleaned that up, and overall the residents, it's overwhelming the positive impacts. I will say, when I went to the Discovery building the first time, there's homeless folks and somebody using drugs in the parking lot, and obviously that's a concern. I imagine it's a concern of all of yours here in California. So Michael seems to have a lot of questions. Michael, I'd be very happy to speak to you one-on-one to get your feedback. I find again that having like a dinner and a show environment greatly increases property values in the area. It increases the overall liveliness and culture in the community, and I think it's a great benefit. That said, I would love to hear your direct thoughts, and I put my email in here if you want to reach out. Happy to speak with you directly. Marissa, likewise, I'd love to hear your thoughts about why it's not an appropriate location, and why again, I'm happy to discuss that. I think so. The traffic you create, Felton, California is significantly smaller than Ventura, as is Petaluma. Okay, let me put my email again. Here. So, being in a small community, but having high quality artists come in, sure, there might be a few cars that come, there might be a few cars and things. And what I'm trying to determine is, for everybody here, is the benefit of the cultural impact and the additional, the kind of non-bar thing to go to, having live music be the kind of default activity for a night out. Does that outweigh any potential negatives. And we're committed to doing everything within our power to mitigate those negatives here. Yeah, Marissa, like if that's rocking your walls, that's a problem. And I'd love to speak with you and find out where you are and how we could go about fixing that. And potentially, we want to make sure that we're only moving forward if it's going to be a benefit to everybody here. So yes, Steve, Michael, Marissa, please reach out to me, and I'd love to have that conversation further.
And Thomas, I have just one last question. So you talked about different fundraisers and different events for all ages. So you're going to have alcohol there. What do you do when it's going to be like, say, a teenage kind of a group of fans that are going to be there?
Yeah, so we've the majority of our shows are for an older audience. I think our average demographic is the sort of 28 to 45 range. However, those younger shows, which is very vigilant on security, staffing, and procedures, and making sure everybody has the proper training to ensure no one's passing drinks, and that folks are properly carded. But we have not had any underage drinking issues at any of our properties, thankfully, and I'll knock on wood for that.
Yeah, and I think Officer Compion would have to make sure that that's going to work if you try to have different ages in there, underage. So, all right, I think we need to go ahead and wrap this meeting up. I appreciate everyone's patience tonight through our technical glitches. And I just wanted to ask if I think Christine Burke, did you have an announcement about your upcoming event? We did put something in the newsletter just very quickly.
Sure, yes, thank you. I appreciate that. We Justice for All Ventura County is holding a two-part event on January 23rd in 4 locations around the county. The one in Midtown, or the one here in Ventura, is going to be at Caffredite. We're going to be dropping off, we're asking the community to donate items for warming packs for our houseless community, so that we can put together warming packs for those who won't be able to make it into the shelter. And that's from 9 to 12 on January 23rd. You can drop them off at Caffredite, which is at 1987 East Main Street. Many of you know where that is. And then the second part of the event is we are holding a virtual town rally, or a virtual event on Zoom, and you can find that on Facebook. You can find it, you can contact me, you can look on our website, justiceforallvc.org. Basically, we've asked organizations and individuals who are involved in the environment, in policy, in economic equity, in cultural equity, basically people who are furthering the work that needs to continue. It's called The Work Continues, Pick Your Passion. They're going to be talking a little bit about how we all can just continue to do the work of being active in our local government, so that we can further our beautiful nation. So,
all right, thank you, Christine.
Thank you.
And I forgot to thank Thomas Cussins for being here and at least sharing your vision for what you'd like to do there, and trying to work solving any issues that may arise. And there certainly were issues with the last operators, and they kind of left town in not a good way. So we hope that you look forward to. I hope that you are able to buy it and provide a nice music hall that's a little bit more tame as far as not upsetting the neighbors. And I'd love to, to be able to walk there and enjoy, a nice concert. A couple of concerts that I went to there, they were so loud and just so loud, we had to text across the table to talk to the people sitting across from us. So and that was Oxymotley. And that was a great concert, except for that we couldn't talk to our friends at all. All right, well, I think we've got to call this off, and really, again, appreciate everyone being here that was able to show up, and I think we'll go ahead and adjourn the meeting. So thank you very much, everyone. Good night.
Night.
Thanks, Dan. Thanks, everyone.
Thank you, guys.
Good night.
Good night. Thank you for coming.